I'm Bill Hoffman, Communications, Department of Laboratory Medicine and Pathology. I'm here with Dr. Michael Tsai. Dr. Tsai is Professor of Laboratory Medicine and Pathology, and he's Director of the Lipid and Cardiovascular Risk Assessment Laboratory.
So I was born in Shanghai, China, and I moved to Hong Kong shortly thereafter. And I attended and graduated from a high school called Queens College. And when I finished my high school, I came to the United States to do my undergraduate studies at the University of Wisconsin, Madison, Wisconsin. And I majored in biochemistry as an undergraduate. And then I continued my study, moved to the Department of Biochemistry at the Medical College of Wisconsin. There I pursued my master's and PhD degree. I have to say, I really liked doing research right after I entered graduate school. And it also helped that I had a very nice thesis project. I had a lot of freedom in designing my own experiments. So all that made the work very pleasant, and I was reasonably productive because of that. So I basically finished my master's and PhD in 4 years, and I published something like 6 papers for first author, 2 of which in the Journal of Biological Chemistry. So my advisors thought, hey Mike, you're a pretty good biochemist, you should continue to do research in biochemistry. And I agree, but I really wanted to do research, however, relevant to human diseases. So shortly after I graduated, I found a position opening just across the street in the Children's Hospital Department of Pediatrics. So it was a position, fellowship position in pediatric clinical chemistry with a research emphasis on pediatric metabolic diseases or biochemical genetic diseases. So while I was in a Children's Hospital, I also had an opportunity of seeing patients from time to time alongside pediatricians, and I saw some interesting cases. I saw cystinosis, pyruvic acid dehydrogenase deficiencies, etc. So seeing patients stimulates my interest in doing research, and I was there developing methods for the diagnosis of these very rare biochemical genetic diseases. So later in my fellowship years, one day I was sitting in the library, I was reading the journal Science, and at that time, the scientific journals has job advertisements, and I saw a job opening at the University of Minnesota. It turns out it was a job from the Department of Laboratory Medicine and Pathology. They were looking for somebody to help with the building up of the then nascent biochemical genetics laboratory. So I applied, I got the offer, and I was told that even though this is a clinical service position, I should have also plenty of time to do research. So that's how I came, I think in May of 1975, and shortly thereafter, I think by 1977, I became an assistant professor and director of biochemical genetics. So this position is very much service-oriented. So I worked to make sure that our lab, biochemical genetics lab, is going to be full-time, full-service laboratory for these rare inborn errors in metabolism. So what I did, I developed a lot of chromatographic assays for organic acid, fatty acid, amino acids. I developed enzymatic assays for lysosomal storage diseases. But we were also, as a genetic lab, stuck with a non-genetic test, which is called fetal lung maturity test. So I had to kind of work to improve this test, and in the process, I introduced an assay called disaturated phosphatidylcholine, assaying for the active component of the surfactant. So the long and short is then I developed a research interest. So this is my first area of research interest in maternal fetal medicine. And so it's things like maternal diabetes, gestational diabetes, and their effect on fetal development. In addition to lung, also study things like patency of ductus arteriosus, etc. So this kind of thing would be relevant later on. I also participated in my first clinical trial with the company Burroughs Wellcome, which was located in the Research Triangle area, and in their introduction of the surfactant therapy for neonates born with respiratory distress syndrome. So this started in around 1986 when the biochemical genetics laboratory, of which I was a director, was asked to merge with the division of clinical chemistry. So once in clinical chemistry, I decided to be involved in so-called what I thought was a mainstream clinical chemistry area, lipid and the lipoprotein. So that's how I started, and as I studied lipid and the lipoprotein, I decided I want to do some research with cardiovascular diseases, because cardiovascular disease then as now is the #1 cause of morbidity mortality in the US. Now, I can't start doing research by myself, so what I did was I contacted the late Dr. Donald Honeyhockey, who was then the director of preventive cardiology. So I talked to Don, and we decided to start with looking at LDL particle sizes, because as we know that smaller dense LDL particles are more atherogenic than large, more buoyant LDL particles. And Donna looked into treating patients with the drug gemfibrozil to lower triglyceride, and we found lowering triglyceride increases the LDL particle size. And that's how we started my research in cardiovascular disease some 30 years ago, and it lasted until the present time. As I was saying that, I was working with lipid biomarkers, but I was also interested in non-lipid biomarkers, and homocysteine is the best example. So this came about in a way because I was wearing two hats. I was the director of biochemical genetics, and my research area is a totally different area in cardiovascular diseases. So this created some confusion, and I was looking forward to find something that unites these two areas. So as the director of the biochemical genetics, I was very familiar with the rare inborn errors of metabolism, homocystinuria. Now these patients have, a very, very high blood homocysteine level. And in fact, they have Marfanoid-like features because they have connective tissue disorders. But very importantly, these patients would develop premature and a very severe thromboembolism. So when I learned then, I read some papers saying, even adults with slightly elevated homocysteine levels in their blood are highly disposed to cardiovascular diseases. I got really excited. I jumped in with both feet, and I made homocysteine a major focus of my research. So that's how it started. And so as a geneticist, I focused this research on the genetic predisposition to hyperhomocysteinemia. And it was in the, I think, mid-1990s, and we managed to sequence the gene cystathionine beta synthase, partially sequence the gene with the Sanger sequencing method, and then we studied the genetic predisposition to hyperhomocysteinemia, which then led to our study of genetic predisposition to cardiovascular disease, period. So all that work is in the 1990s. It lasted about 10 years, intensely focusing on this for 10 years. But recently I went back and wanted to take a second look. So just a few days ago, one of our papers got accepted looking at homocysteine in the coronary artery calcification, and a couple more papers being prepared on homocysteine, cardiovascular diseases, and also heart failure. This all started in about 1999. I got involved with the study MESA, also known as the Multi-Ethnic Study of Atherosclerosis. So we began planning MESA in 1999. So this reflects a very important point in my research career. It's an inflection point in my career. The reason I got involved, I think it was my previous work was lipid, lipoprotein, fatty acids, homocysteine, and the genetic predisposition to cardiovascular disease made me a great candidate in matching with the interests of MESA, and as such, I became the director of one of the central laboratories of MESA. So we started recruiting participants in the year 2000, and we end up with 6,800 participants, and we have been following them for 20 years. And we're still doing this. This is continuing. We're going to see them for the 7th examination in 2021. Now, GOLDN started, I think, shortly thereafter, probably around 2003. GOLDN, or Genetics of Lipid-Lowering Drugs and a Diet Network, started, I think, shortly after MESA, I think in 2003. And I also became the director of the central lab because my interest, my previous work in fatty acids, triglyceride, and lipoprotein particle sizes. Now, with regard to the two more recent studies, FAST and BWELL-Mom, these are acronyms. These are two of the many studies which really rooted in my collaboration, which started in 2009 with the Division of Population Research with National Institute of Child Health and Development. So this started for many reasons. One is that I had an interest in maternal-fetal medicine early on, as I mentioned before, but also because my collaboration, my work with MESA, GOLDN, Cardia, but very importantly also we made available a test which I developed in my lab, that of the phospholipid fatty acid, to some East Coast studies, namely Physicians' Health and Nurses' Health. So this got me connected with NICHD, and so this is a very long-term collaboration. It is in its 10th year, and I think it's going to continue for many more years to come. So it is truly gratifying to be recognized by your peers, and it is also humbling, and knowing how little I've accomplished, receiving these awards just makes you want to work harder in the hope that you can accomplish a little bit more in the years to come. So looking at what we're going to do, so currently, for example, in the area of lipid and lipoprotein, so in the last decades, we have focused on two biomarkers, Lp(a) and ApoB, and I'm really gratified by the fact that these two biomarkers have just recently been incorporated in the 2018 American College of Cardiology, American Heart Association guideline, and they recognize these as so-called risk-enhancing factors. So now these biomarkers can officially be used to assessing risk in patients with what they call intermediate risk. Now, we're going to continue to work on these and other biomarkers. So currently, one of the things that we're working on is to assess how we can best optimally use these risk-enhancing factors with the CT scan, which quantifies the coronary artery calcium. So this work continues. In another area, as I mentioned before, in the phospholipid fatty acid, which I really started, again, as a clinical service endeavor in the early 1980s when Frank Serra came and became the director of surgical ICU, And Dave Brown, who was my mentor, asked me to help him, and we developed this test to assess essential fatty acid deficiency. It was used just for a short time in the service laboratory, but we made it into a research tool, which became very important. So we made available the phospholipid fatty acid profile not only to MESA, GOLDN, also to Cardia, Physicians' Health, Nurses' Health, and the results from all these studies now have demonstrated, elucidated the relationships between different types of polyunsaturated fatty acids with cardiovascular diseases, with heart failure, and even with diabetes and insulin resistance. So what's next? Well, what we want to do in the next step, I really want to do, is to elucidate the biochemical basis, why these different kinds of polyunsaturated fatty acids are beneficial to different kinds of diseases. So I must say that I'm a very fortunate person that I started my career in the Department of Laboratory Medicine Pathology, and being here for more than 40 years. Very importantly, I started out in service. My major responsibility was in clinical service. So what I did is and I was given time to do research. So what I did was to leverage the knowledge I gained from doing clinical service and make it help with my research. So in the end, it's the synergy between research and the service which contributed to the success of both of these areas. So my research is always collaborative. So I'm, gratified the fact that over the years, I had the opportunity of collaborating with many distinguished colleagues, both here at the U and at many other universities. But even more importantly, I was privileged to have many talented and devoted individuals on my team, and which makes it possible for me to get going and my research to get going in the last 40 plus years. And with the advent of all these new technologies, I hope to leverage these new technologies and make my research more successful in the years to come.